Day. Pelvic organ prolapse is a very common disorder. You may have heard the term cystocele. That means dropped bladder. Rectocele is a dropped rectum, and there's uterine prolapse. This condition affects 1 out of every 3 American women. So about 30% of women over the age of 40 have some form of prolapse. And about 11% of them are getting surgery for it. The most common culprit for pelvic organ prolapse is childbirth. And what happens as the baby is coming through the birth canal, there can be damage or some stretching that occurs to the support elements, the connective tissue that support the bladder and the rectum and the uterus. There also can be some direct damage to the muscles and some compression of the nerves. And all of that can cause these organs to prolapse, and also can cause some problems with bladder and bowel control. So that's the bad news, is that it is relatively common. The good news is that there are some things that women can do, not only to prevent, but also to treat. To prevent, obviously, doing pelvic floor muscle exercises would really help with the muscles and to make them as strong as they can be. Not being overweight is another thing that would be very helpful, so there's less pressure. And certainly having a smaller baby, you're not gaining a lot of weight during pregnancy. For treatment options, once you have the condition, a pessary, which is sort of like a diaphragm device, can be placed into the vagina, and that can help. But there are also treatments that can be done minimally invasively using vaginal surgery. That means no incision surgery, which is really the natural orifice type of surgery, or surgery done laparoscopically using the laparoscope or the robot. And these surgeries can be in and out types of surgeries that can be very beneficial to women, so that they can have improved quality of life, not only as they get older. And when we look at everything in sum total, your pelvic floor is very important for sexual health, and certainly for bowel and bladder control and just overall wellness.